Escitalopram is used to treat depression and generalized anxiety disorder. It is an antidepressant that belongs to a group of medicines known as selective serotonin reuptake inhibitors. These medicines work by increasing the activity of the chemical serotonin in the brain. This medicine is available only with your doctor's prescription. This product is available in the following dosage forms: tablet, solution. Proper use. Take this medicine only as directed by a doctor to benefit your condition as much as possible. Do not take more of it, do not take it more often, and do not take it for a longer time than the doctor ordered. This medicine should come with a medication guide. Read and follow these instructions carefully. Ask your doctor or pharmacist if you have any questions. Escitalopram may be taken with or without food. If your doctor tells you to take it at a specific time, follow your doctor's instructions. If you are using the oral liquid, check the bottle well before measuring each dose. Use a market measuring spoon, oral syringe, or medicine cup to measure each dose. The average household spoon may not hold the right amount of liquid. You may have to take escitalopram for a month or longer before you begin to feel better. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For oral dosage forms, solution or tablets. For depression, adults and children 12 years of age and older, 10 mg once a day. Take either in the morning or evening. Your doctor may adjust your dose as needed. However, the dose is usually not more than 20 mg per day. Older adults 10 mg once a day, taken either in the morning or evening. Children younger than 12 years of age, use and dose must be determined by a doctor. For generalized anxiety disorder, adults at first 10 mg once a day, taken either in the morning or evening. Your doctor may adjust your dose as needed. However, the dose is usually not more than 20 mg per day. Older adults 10 mg once a day, taken either in the morning or evening. Children use and dose must be determined by a doctor. Who may not be able to take escitalopram. Escitalopram is not suitable for some people. To make sure it's safe for you, tell a doctor before taking escitalopram if you have ever had an allergic reaction to escitalopram or any other medicine, have epilepsy, or are having electroconvulsive treatment. Escitalopram may increase your risk of having a seizure. Have a heart problem. Escitalopram can give you an irregular heartbeat or make your heartbeat faster. Have ever been tested for low sodium levels. Are trying to become pregnant, already pregnant, or breastfeeding. Have glaucoma. Escitalopram can increase the pressure in your eye. Precautions. It is very important that your doctor check your progress at regular visits to allow for changes in your dose and to help reduce any side effects. Blood tests may be needed to check for any unwanted effects. The use of alcohol is not recommended in patients who are taking escitalopram. Do not take other medicines unless they have been discussed with your doctor. Side effects of escitalopram. Like all medicines, escitalopram can cause side effects in some people, but many people have no side effects or only minor ones. Some of the common side effects of escitalopram will gradually improve as your body gets used to it. Common side effects: feeling sick, nausea, headaches, a dry mouth, sweating a lot, being unable to sleep, feeling sleepy, feeling tired or weak. Speak to a doctor or pharmacist if the advice on how to cope does not help and any of these side effects bother you or last more than a few days.